Let's talk a bit about the waking up process, because waking up can be one of the most difficult parts of the whole heart surgery experience. There will be a lot of things going on around you, and if you know what is happening and why, then it makes the whole process much more tolerable. This is the part that I spend the most time talking with my patients about, and although some patients don't like to talk about it, I can tell you that after surgery, almost every one of my patients say that they are glad that I took the time to explain everything to them. So let's begin. If you have ever had general anesthesia before, then you know that when you are waking up, you can be somewhat disoriented. The confusion can sometimes be very mild, like waking up from a very deep sleep, but it can also be more like, where the heck am I? Truthfully, we don't know exactly where you're going to be until it happens. But just so that you know, you will be somewhat disoriented as you are waking up. There's also a chance that you will wake up with a breathing tube still in. The proper word for this is intubated. Although this can be very unpleasant for most patients, if you understand what is going on, how it feels, and what to expect, it is something that I'm sure you can tolerate. As I said earlier, you will be somewhat disoriented as you are waking up. The next thing that you will realize almost instantly is that your arms are tethered to the bed. Now, I picked the word tethered very carefully because I don't want you to think that you're tied to the bed and you can't move. You can move your arms up and down a bit, and you can move them from left to right a bit. But what you can't do is try to reach up and pull the breathing tube out of your mouth, which is exactly what you would try to do. And if you were to do so, you could hurt your throat. The next thing that you do is you try to speak, and you can't speak because the breathing tube goes through your vocal cords. Put those three things together, and usually at that point, you're feeling pretty anxious. It's at that very moment that I hope that you will hear me in the back of your head saying, I should be trying to relax. If you can do so, then you're doing the best thing that you can do at that particular moment. Let me explain why the breathing tube plays such head games with you and why it upsets patients so much. We are all hardwired to go, but while the machine is breathing for you, you don't need to go. And yet everything in your brain is telling you that you should be going. The second thing is that when we breathe naturally, we feel air pass into our mouth or through our nose. But you don't feel that either because everything is inside that tube that is in your mouth. So while everything in your subconscious is telling you that you're not breathing, actually you're breathing just fine. You're obviously okay. You're lying here in bed. No one's running around the room panicking. Your blood oxygen levels are obviously fine. But everything inside your head is still telling you that you should be breathing on your own. And that messes with your head. So what you need to do is to let your logic convince your emotions that everything is just fine, and try to do your best to relax. Now, the machine knows that you want to take a breath, and so it will allow you to initiate a breath, but it won't feel like a normal breath. It will feel more like you're sucking air through a straw, kind of like this. But that's because there's a breathing tube inserted into your airway to supply you with oxygen and remove carbon dioxide. When you initiate that breath, you will be sucking air in through the breathing tube that is longer and smaller than your natural airway. So when you take that breath, it will feel much more labored. Also, remember when I said that when you breathe normally, you feel air pass through your nose and your mouth, and so your brain knows that you are breathing because you feel it? While the breathing tube is inserted in your airway, you don't feel those feelings. So your brain again thinks that you aren't breathing, but in fact you're breathing just fine. As I said, for those reasons, it won't feel like a normal breath. So don't let it get you upset. But now that you know what to expect and how it will feel, if you do force a breath, don't get freaked out by how it feels. I'm asked the same group of questions by most patients all the time, so let me answer them for you and maybe it will help a bit. First, why do I have a breathing tube in anyway? During surgery, you're given a paralyzing agent as part of your anesthesia. It stops you from doing those little jumps and twitches during surgery that we all do, like when we're falling asleep at night. That same paralyzing agent stops your diaphragm from working on its own during surgery, and so the reason why you have a breathing tube in during surgery. As you are waking up, if you are not sufficiently off of your anesthesia, then you may not be able to breathe completely on your own. And that is the most common reason why it may still be in as you are waking up. The second question is, does it hurt? And the answer is no. The best way I can describe the feeling is that it's like swallowing a lump of ice cream. You can feel that ball in your throat. That's kind of what it feels like. It has an inflatable end, and so if you're hard-pressed to think about the feeling, imagine feeling like a lump of ice cream in the base of your throat. The third question is, am I going to gag? And again, the answer is no. The back of your throat will be sprayed with a topical anesthetic to numb it out, and so you don't even feel the tube, and so you don't gag. Now, is there someone out there who has gagged? I'm sure there is, but in the last 4 years, I haven't met a patient yet who did. I have a very sensitive gag reflex myself, and I didn't gag at all. And the last question is, how long will it be in? The truthful answer is, we just don't know. Every person is completely different. Some CABG patients wake up and their breathing tube is gone. Others can have it in for several hours. Every patient wakes up differently, and so we just don't know. But let me assure you that everyone does their best to get the tube out just as quickly as possible. Last but not least, removing the tube is both easy and quick. You will go through a weaning process and have some parameters checked. Then you will be asked to cough and blow, and the tube will be out in moments. It kind of sounds and looks like this. Once it is out, you can speak instantly, the tethers come off your arms, and you're breathing completely on your own. Things go back to normal pretty quickly. Now, having told you all of this difficult stuff, remember that for CABG patients, there's a chance that you will wake up and the tube won't even be there. Okay, here are a few tricks I can offer you. Some patients, while the tube is in, pray. Some try to remember the words to old songs. Some try to remember the names of kids they went to grade school with. Me, I counted the cadence on the machine itself. Whatever works in order to take your mind off of just laying there and thinking about that tube that's in your mouth. Okay, now that I've scared you, remember, you can do it. Just relax and stay calm. And remember those tricks I shared with you. By the way, if you are a valve repair replacement patient, you will definitely wake up with a breathing tube still in. And generally, heart valve repair replacement patients have their breathing tubes in a bit longer. If you are a CABG patient, we just don't know until you are waking up exactly if and how long your breathing tube will be in place. Once your tube is out, or if you wake up without one, you'll be aware of several other things that are happening around you. So let's take a few moments and talk about them. First, you'll feel a buccal piece of plastic on the right side of your neck, just about at your collarbone. Think of this as sort of like an overblown IV. It is used to hook you up to multiple bags of fluid should you need them. It also measures your arterial blood pressure and also measures the pressures in your heart. I tell you about it because you will be able to feel it on the side of your neck, but you won't be able to see it. It's nothing to worry about, and now that you know what it is, it shouldn't bother you. You will also have a catheter inserted in your bladder, so there's no worries about having to urinate. Next, you will also have 2 tubes coming out of your belly just below your incision. The tubes go to one and then to a collector on the side of your bed. These tubes are there to let any excess fluid drain from your chest cavity. They're about the size of my little fingers, and they're stitched into place. They are uncomfortable, but I wouldn't describe them as hurt. I would describe them as a really squirrely kind of feeling. Both the neck tube and the belly tubes generally stay in for about 24 to 48 hours. I'll give you some tricks for when they are removed a little later. The next thing you will notice is that you're as dry as a bone. Your mouth is dry, your eyes feel dry, even your skin feels dry. That's because you were given some medicine to stop you from aspirating or choking on your own spit while you were in surgery and you had your breathing tube in your mouth. Your nurse will listen to your belly to hear some belly sounds, and once we know that your stomach has woken up, your nurse will start giving you some ice chips and little sips of water. This is done to make you feel more comfortable, but just remember, it takes 24 hours for that medicine to wear off. And so time solves the problem, not ice chips and not water. Too much ice and water just makes for an upset stomach. So try not to overdo it. To put it into perspective, in the first 24 hours after surgery, you will come to realize just how much compassion can be squeezed into a plastic spoon and a piece of ice, because it is all that you want. Just so you know, you will have a nurse with you the first full 24 hours after your surgery. No one leaves you alone during this time. And also, while we're talking about your time in what most people think of as intensive care, ask your family to do two things for you. First, when they come to see you just after surgery, ask them to speak to you as if you are awake. You may not look like you're awake, but I can tell you from personal experience that I knew everyone that was in the room because they were talking to me. And it's really nice to hear friendly voices. Second, once they know that you're okay, ask them to go home. I'm not trying to get your family to leave early, but once they know that you're okay, they need to go home. And here is why. Your first 24 hours after surgery is the most difficult part of the process, and it is the time when you will feel the worst. Not because of pain. I'm asked all the time, does heart surgery really hurt? The answer is no. Hospitals have all the good stuff to keep you just as comfy as a clam. I won't say it's not uncomfortable. Let's face it, you have a broken bone in your chest. But at no point did I ever go, ugh. But what it is, and what we can't take away, is that it's extremely exhausting. You will be tired down into your socks. For that reason, I'd like you to go into that place where we all go when we're not feeling very well. You know where that place is. It's that place where you just want to be left alone. If you go there, relax, and give your body a chance to bounce back from the trauma that it's just been through, you are doing the best thing possible to help yourself heal. But if your family and friends are there, you will become a caregiver. Gee, honey, it wasn't as bad as I thought it would be. I'm okay. Pick whatever word you want. That's what you will do. You won't go to that place I described. And that's exactly where I need you to go. If you do as I ask, I can almost promise you that your second and third days will be way better. Think about this. Your family is also exhausted from the day as well. They have been on an emotional roller coaster. They've waited through your surgery. They've been worrying about you all day. Frankly, they're worn out just like you. If they go home, get some food in their belly, and get some sleep, when they come back the next day to see you around noon or so, your visit will be a lot more productive. What good does it do for them to stay with you when you are at your worst? By noon the next day, both you and they will be feeling a lot better. I'm asked all the time if I can describe each day after surgery in an easy to understand way. It kind of goes like this. First day, and by a day I mean each 24-hour period after the time you wake up. So if you wake up at 6 p.m. the day of your surgery, a day to me is until 6 p.m. the next night. So the first day can be a real bummer for all of the reasons I've already described. But the biggest reason is that overwhelming sense of exhaustion that I described. The soreness of the broken bone in your chest, which is like a dull, thuddy, achy feeling. Some residual discomfort because things have been moved around, and a dry mouth. But remember, try your best to use this time to relax. Let your nurses take care of you. Using this time well helps you to do your best to bounce back. Your nurse will continue to ask you, are you pain-free? If you're having pain, your nurse will ask you, on a scale of 1 to 10, 10 being the worst, what level is your pain? You need to tell your nurse so that he or she can give you whatever pain medication you need to make you feel comfortable. Your nurse is asking you this for 2 reasons. First, no one wants you to feel any worse than you need to feel. And second, if you're in pain, you won't go to that place that I described, and that is exactly where I need you to go. It's important that you stay pain-free. The second day, it goes down to, okay, I can get through this. You'll be out of bed. You'll be sitting in a chair. Your catheter will most likely be out. You may even do a little walking. Your family will be back to see you. You may have had a little something to eat, and you'll be conversing with your nurses. Life is starting to go back to normal a bit. It's not unusual for you to do some coughing as you begin sitting up and moving around. Most hospitals will give you some type of pillow to hug, sometimes heart-shaped. If you feel a cough coming on, by hugging this pillow when you cough, it helps to take away some of the discomfort. You will also be asked to use a tool called an incentive spirometer to help with your breathing after surgery. Using an incentive spirometer can help you to practice taking deep breaths, which can help to open up your airways, prevent fluid or mucus from building up in your lungs, help to ward off pneumonia, ease the amount of coughing you may do, and generally make it easier for you to breathe. Your nurse or your respiratory therapist will give you instructions on how to use it. You may also be asked to use an acapella. It is a small tool, sort of in the shape of a piece of fruit, that you blow into and it flutters. It also helps to break up any excess mucus that may be in your lungs. Here's a helpful hint. Do both exercises during the TV commercials. Okay, the third day. You're starting to feel more like yourself. You'll be out of the intensive care room. Your neck tube and maybe even your belly tubes will be out, and most of your IVs as well. As for that trick we talked about when the belly tubes are being removed, when they take the neck tube out, it's kind of like having an IV tube removed. But when they take out the belly tubes, they can be a bit more ouchy. They will snip the stitches that hold them in place, ask you to take a few deep breaths, put their hand on your belly, and give a quick yank, and they're out. It's about 10 or 15 seconds of a good ouch, followed by about 15 or 20 minutes of feeling like you sort of just got thumped in the belly. A little trick, look away and not at your belly when they're taking them out. Try to keep your thoughts on your breathing and not on your belly. If you think about your stomach, then you're going to anticipate the yank. You'll just tighten up your stomach muscles, and then you're just holding on to the very tubes that they're trying to pull out. Believe me when I tell you, this trick works. I used it myself. You're also doing some walking, and you're getting some visitors. You're getting ready to go to the progressive care unit, or what is sometimes called a step-down unit. Your fourth or fifth day, you're starting to feel pretty good. You're getting around better, and you're getting sick of being in the hospital. Most CABG patients leave the hospital on their fourth or fifth day and are anxious to begin their recovery at home. Remember, we all recover at different rates. I've tried my best to be as accurate as possible based on my own personal experience and on the hundreds of patients that I've worked with over the last several years. Use this information as a guide to your own recovery, but never use it as a replacement for the care, guidance, and advice of your healthcare professional. The next video will give you some practical information and tips to follow when you go home.